It is important to note initially that a significant proportion of shoulder injuries do not require an operation, at least not straight away. Most of them will do very well with non-operative management. However, there are some instances where I do advocate surgery as the first-line treatment. For example, in a traumatic rotator cuff tendon tear after a fall, surgery is the best option. Following a glenohumeral or shoulder dislocation with significant instability with and without bone loss, I would also advocate surgery. Recent studies have shown that early surgery following even a first-time dislocation is very important and prevents from having further dislocation as well as protects the joint. High-grade acromioclavicular joint dislocations or separation also necessitate surgery as the first-line treatment. Displaced fractures of either the clavicle or the proximal humerus or fracture dislocations of the shoulder are also absolute indications for surgery. Multiple injuries of the upper limb in significant road traffic accidents also necessitate urgent surgery. Traumatic biceps tendon tears also necessitate surgery. It's crucial that you go and see a specialist as early as possible to decide whether operative or non-operative treatment will be the best way forward. This is because in a lot of these injuries mentioned above, it is time critical and time sensitive. If an operation is needed, we need to perform the surgery as early as possible.